चलो.
Trigger point release technique with the IASTM. So we have to palpate the trigger point. Maybe we can go for flat palpation, or maybe we can go with the pincer grip. So you can see the winces on the patient. So might be that person having a trigger point on this area. So with thumb, we can simply place our thumb and press. During this press, you can see the hyper extension of my thumb. It's quite hurt to me, and even I'm not able to maintain it for a few seconds. So we can use the IASTM tool. Make sure your tool must be bevel that area. Just apply the tool directly on the trigger point. This is trigger point. Just keep the tool on the trigger point area, and with this right hand, just apply the just keep the hand little bit next to the trigger point area. Then apply the pressure and just ask for pain score according to the visual analog scale. If the person having a pain score around 5, so just apply the pressure and waiting for 5. Do you have pain? Yeah. So right now in the pain, how much score you have? 0 means no pain. 10 means it's extreme pain. So can you explain how much it?
5.
5. Okay. So 5, it's no problem, because below 5 there is no neurophysiological response. If it's above 5, then might be then muscle will be go for what I can say defense mechanism. They're going to activate the defense mechanism, and we will get the spasm. So in this case, simply just apply the tool, drop the pressure, and with this left hand, simply we are going to increase the angle. While increasing the angle, automatically we are increasing the pressure. Right now, how much pain you have, my friend?
6.
It's about 6. So about above 5, it means we have to wait for a few seconds. And after a few seconds, if the score is going to be decreased, so again we can increase the angle. So we have to wait for around 20 to 30 seconds. Normally in the 20 to 30 seconds, pain score must be going to be reduced. Maybe sometime it's going to be increased. If you feel pain score is increasing, then you have to stop the treatment. But if you feel pain score is decreasing, then we can increase the angle. Right now, my friend,
Around 4-5.
it's around 4-5. It means it's manageable. This pressure, what I exerted from the right hand, remains same. Just we are changing the angle. Now,
6.
at 6. So between 5 to 6, manageable, no problem. We have to increase the angle. Now,
6.
again 6. So once we reach around 45, now
7, 8.
at 7, 8. So we have to wait for a few seconds. We just want to reduce the pain score. Once it will become 4 to 5, and once we reach around 45 degree of angle, then slowly we are going to make a rotate this tool. For your explanation, I'm just changing the grip. This pressure remains same. This will look like 45 degree of angle. Once you reach on 45 degree of angle, then simply just rotate the tool to get the release in the surrounding areas. Pressure on, pressure off, pressure on, pressure off, pressure on, pressure off, and keep changing the direction of your tool to cover this entire area. Take example, this is only the trigger point area, but because of this trigger point, they're also going to create some localized spasm around the trigger point. So place the tool, go for 45, and pressure on, pressure off, and we are changing the direction of tool. This way we can treat the trigger point with the use of IASTM. Why not using the myoblaster? Also we can use the myoblaster, but also myoblaster is short arm. So in this technique, it's quite tough to get the proper pressure on that area. So we love to go with the long handlebar. It will help you to provide more pressure just without just increasing the angle. If you have this myoblaster, then also we can perform, but again some limitations in the myoblaster. So my suggestions, always we will go with the long handlebar.